Welcome back to Weekly Wrap with HealthCap. We've got a packed episode for you this week with stories that touch on regulations, cutting-edge technology, and health innovations, all directly impacting senior living communities.
That's right. From new CMS guidance to advances in AI and dementia care, there's a lot to unpack today. Let's jump right in and get started.
Let's start with an important update from CMS. They've just issued the Admin Info 25-04-NH memo, which outlines some significant revisions to the Civil Money Penalty Reinvestment Program, or CMPRP.
Yeah, this one's a big deal for senior living communities. The changes simplify how states submit their CMP reinvestment plans and project applications. Everything now goes through a centralized CMPRP team via email. Talk about streamlining.
Absolutely. It's part of CMS's effort to improve efficiency and reduce back-and-forth delays. They're also aiming to ensure that these funds, collected from penalties, are effectively used to improve residents' quality of care and quality of life.
Right, and the memo also mentions that states need to submit their annual CMP state plans by October 31st every year. That's a tight timeline, so it's crucial for communities to stay organized and proactive.
Definitely. Another key update is the discontinuation of the communication technology and visitation aid category. Now that the public health emergency has ended, CMS stopped accepting applications in this category as of January 1st, 2025.
Yeah, it's a shift, but it makes sense with the public health emergency officially behind us. CMS is focusing on other priorities now, like improving workflows and addressing more current challenges in resident care.
Speaking of priorities, the memo also highlights a new quality and focus video series aimed at reducing common deficiencies, like infection control and accident prevention. These short 10 to 15-minute videos are tailored to providers and could be a great resource.
And that's not all. CMS has revamped their online resources to reflect these updates. Anyone working in senior living should check out the details on their website to stay ahead of the changes. That's qsep.cms.gov.
It's a lot to digest, but these updates underline how critical it is to stay informed. They're not just compliance updates. They directly impact the quality of care we provide.
Couldn't agree more. Keeping up with CMS memos like this ensures we're delivering the best for our residents while meeting regulatory standards.
Moving on, AARP recently released a press statement highlighting their latest initiatives to support older adults. This one really caught my attention.
Yeah, and it's a comprehensive effort, focusing on everything from improving healthcare access to addressing financial security challenges for seniors.
What stood out to me was their push for more affordable prescription medications. That's a huge concern for so many residents and their families.
Absolutely. They're also advocating for policies that expand access to caregiving resources. It's all about making sure older adults and their families have the tools they need to navigate care more effectively.
And it's not just about the big picture policies. AARP is working on community-level initiatives too, like educational programs that help seniors understand their benefits and make informed decisions.
If you want to learn more, AARP's full press release goes into detail about these efforts. You can check it out on their site.
It's always inspiring to see organizations stepping up for older adults. Initiatives like these remind us of the importance of advocating for our residents' needs.
You're absolutely right. Every step we take to support seniors is a step towards stronger, more compassionate communities.
Here's a topic stirring up a lot of conversation. Senior living groups are raising concerns about the use of in-room surveillance cameras. According to a report from McKnight's Senior Living, these cameras may pose risks to resident privacy and dignity.
Yeah, we talked about this last week. It's a tough one. On the one hand, cameras can improve safety and help monitor care. But on the other, there are serious ethical and privacy issues to consider.
Exactly. The report points out that many senior living groups are questioning whether the potential benefits outweigh the risks. They're especially concerned about how these cameras could impact residents' sense of autonomy and trust.
And it's not just a privacy issue, it's about dignity. Residents deserve to feel like their personal space is truly theirs, free from constant monitoring.
You're right, and there's also the question of consent. Some residents might agree to surveillance, but what about those who can't make that decision for themselves? It's a tricky balance.
The article highlights how important it is for communities to have clear policies and open conversations with families about the use of surveillance. HealthCap offers sample policies and procedures, as well as sample consent forms to help communities navigate this challenge. Anyone can download these resources for free at riskmanagement.healthcapusa.com.
At the end of the day, it's about finding solutions that protect residents while respecting their privacy and dignity. It's not an easy task, but it's one worth prioritizing.
Definitely. This is a conversation that needs to happen at every level, from community leadership to families and caregivers.
Shifting gears to global health, the World Health Organization has issued a new disease outbreak news report. It's always a good idea to stay aware of emerging threats.
Right, this one highlights a respiratory infection outbreak happening in the Northern Hemisphere. While it's currently localized, it has the potential to spread if not contained. It's a reminder of how interconnected our world is and how quickly things can escalate. One of the most notable aspects of the report is the detailed guidance the World Health Organization provided for managing the outbreak. They're calling for enhanced surveillance and immediate reporting to prevent further transmission. And even though this might feel distant, it's a good opportunity for senior living communities to revisit their infection prevention plans. Staying prepared is half the battle.
It sure is. Whether it's monitoring symptoms or reinforcing hygiene protocols, proactive measures make all the difference. The full WHO report has more details and recommendations, and you can find it on their site at who.int.
It's always better to stay ahead of potential risks. Even if an outbreak doesn't directly impact us, there's always something to learn from how it's managed elsewhere.
Agreed. Preparedness and adaptability are key, especially in senior living communities where resident health is a top priority.
Let's turn to some fascinating news in healthcare technology. According to a report from Medical Express, artificial intelligence has surpassed current methods in analyzing brain scans. This breakthrough could revolutionize how we diagnose neurological conditions.
Yeah, it's impressive. AI models are proving not just faster, but also more accurate in detecting abnormalities in brain scans, which could mean earlier intervention for conditions like dementia and strokes.
What's really exciting is how this could impact senior living communities. Early and accurate diagnoses give residents and their families more time to plan care and explore treatment options. It's a game changer.
It really is. And the potential doesn't stop there. The report suggests that AI could also reduce the workload on radiologists, allowing them to focus on complex cases where human judgment is essential.
Of course, there are still hurdles, like ensuring these AI systems are widely accessible and that their findings integrate seamlessly into existing workflows.
For communities interested in staying on the cutting edge of healthcare, this is definitely something to watch. You can read more about this breakthrough on Medical Express.
It's another example of how technology is reshaping the way we care for residents, offering new tools to improve outcomes and enhance quality of life.
It really is. As AI continues to evolve, its ability to support care teams and improve resident outcomes will only grow, making it an invaluable asset in senior living.
Building on that, let's talk about an important aspect of AI's growth: regulation. While the potential of AI in healthcare is exciting, the Paragon Institute recently highlighted the need for clear regulatory frameworks to ensure its ethical and effective use.
Yeah, with AI now outperforming traditional methods in areas like brain scans, as we just discussed, it's clear that this technology is here to stay. But without proper oversight, we could see issues ranging from biased algorithms to data security breaches.
The Paragon Institute wrote an article that emphasizes the importance of balancing innovation with accountability. For example, regulations should address transparency in how AI systems make decisions, especially when those decisions impact resident care.
And let's not forget about training. Care teams need to understand how to interpret and use AI-generated insights effectively. Regulation could play a role in standardizing that education across the industry.
If you want to explore this topic further, the Paragon Institute's analysis is a great resource. You can find it on their website.
As AI continues to transform healthcare, ensuring its responsible implementation will be key to unlocking its full potential while safeguarding residents' trust and well-being.
Ending on an uplifting note, there's even more exciting news about early dementia detection. Utah State University's ADRC director has partnered with a small business to develop a groundbreaking early screening test for dementia.
Yeah, and this partnership is all about innovation. The test aims to identify cognitive decline earlier than traditional methods, giving families and care teams a head start in planning and intervention.
One of the key features of this screening tool is its accessibility. The goal is to make it widely available so that communities, big and small, can benefit from early detection.
Exactly. The earlier we can catch signs of dementia, the more options we have for care and support. It's a win for both residents and their families.
The collaboration between researchers and small businesses really highlights how much progress can be made when different sectors come together. You can read more about this inspiring project on the Utah State University website.
If your community supports residents living with dementia, you might want to check out HealthCap's free Dementia Activities Toolkit. It's packed with helpful resources to enhance resident engagement and is available for download at no charge at riskmanagement.healthcapusa.com.
This is a reminder of the incredible work being done to improve senior living care, and it's a perfect example of how innovation continues to push us forward.
Thanks for joining us on this episode of Weekly Wrap with HealthCap. From the latest AI advancements to groundbreaking tools for dementia care, it's clear that innovation is driving the future of senior living. Whether you're exploring new technologies, refining your compliance practices, or enhancing resident engagement, every step makes a difference.
Remember, HealthCap has plenty of resources to support your journey, including free toolkits and guidance tailored for senior living communities. Be sure to check them out at riskmanagement.healthcapusa.com.
We'll be back next week with more updates, insights, and stories that matter. Don't forget, you can access all of the stories we talked about in the weekly Roundup blog under Angie's blog on our website at healthcapusa.com. Until then, stay well and stay informed.